Welcome to an exploration of how elite performers use mental simulation to achieve peak performance. Mental simulation is a powerful technique where athletes and performers rehearse their actions in their minds, activating the same brain regions as actual physical practice. Let's start by understanding what mental simulation actually is and why it works. Research shows that vivid mental imagery activates the motor cortex in your brain, the same area that controls actual physical movements. Studies using brain imaging show remarkably similar activation patterns between physical practice and mental practice, with overlap rates of 70 to 80%. Mental imagery produces approximately 70 to 80% of the neural activations seen in actual physical practice. What separates elite performers is that they rehearse both success scenarios and potential breakdowns, preparing their minds for any situation. Now let's dive deeper into the neuroscience that makes mental simulation so effective. Mental simulation engages multiple brain regions, the motor cortex for movement planning, the visual cortex for imagery, and the prefrontal cortex for decision-making. You might wonder, why does simply imagining a movement activate the same brain regions responsible for actually performing that movement? The answer is that your brain uses the same neural pathways for planning and simulating movements as it does for executing them, strengthening those connections each time. Neural pathway strength is proportional to the number of repetitions multiplied by the vividness of the mental imagery. Let's look at some actual numbers showing how effective mental practice really is. Research shows that mental practice alone improves performance by about 35%, physical practice by 45%, but combining both yields improvements of 75% or more. The combined improvement from mental and physical practice is approximately 1.3 times the sum of individual improvements, showing a synergistic effect. A famous 2014 study demonstrated that basketball players improved their free throw accuracy by 23% using only mental practice over 3 weeks. Elite performers use a specific structured approach to mental simulation that we call the mental simulation loop. The mental simulation loop consists of 3 phases: visualize the action in detail, execute it mentally or physically, then refine based on feedback. How detailed should your mental visualization actually be to get maximum benefit? Research shows the most effective visualizations include all sensory details, what you see, hear, feel, and even smell during the performance. Visualization effectiveness can be modeled as a weighted sum of all 5 sensory modalities, where each sense contributes to the total impact. Let's examine how elite performers rehearse success scenarios to build confidence and muscle memory. Success rehearsal follows a progressive pattern, starting with simple successful outcomes and building to complex peak performances. First, visualize perfect technique in slow motion, paying attention to every detail of form and execution. Second, add real-time speed while maintaining all sensory details, feeling the rhythm and flow of the movement. Third, include environmental factors like crowd noise, weather conditions, or competition pressure to make it realistic. Studies show that actual performance success rate tends to be about 85% of the success rate achieved in consistent mental rehearsal. Olympic gymnasts typically mentally rehearse their routines over 200 times before major competitions, each time visualizing flawless execution. Equally important is rehearsing potential failures and how to recover from them. Elite performers mentally rehearse breakdowns and mistakes, then visualize calm, effective recovery responses to build resilience. You might ask, why would we rehearse failure scenarios if our goal is success? The answer is that pre-experiencing failure in a safe mental environment reduces panic responses and enables much faster recovery when real problems occur. Athletes who mentally rehearse breakdown scenarios recover approximately 60% faster than those who only visualize success. Medical research shows that surgeons who mentally rehearse potential complications have 40% fewer adverse outcomes during actual procedures. One of the most powerful benefits of mental simulation is its ability to reduce performance anxiety. As performers increase their mental practice sessions, measured stress hormones like cortisol decrease significantly, creating a calmer performance state. Cortisol levels decrease exponentially with mental practice hours, following approximately an exponential decay function with rate 0.15. Research shows that after just 20 hours of structured mental practice, stress hormone levels drop by 40 to 50% during performance. Through repeated mental simulation, the brain learns to categorize performance situations as familiar rather than threatening, reducing the fight-or-flight response. Let's look at the optimal protocol for implementing mental simulation in your training. An optimal 35-minute mental practice session includes 15 minutes on success scenarios, 10 on breakdown recovery, 5 on environmental factors, and 5 on emotional control. Research indicates optimal results come from 5 to 7 mental practice sessions per week, each lasting 30 to 40 minutes. The most effective time for mental practice is just before sleep, when memory consolidation processes are most active during the night. Maintain approximately a 70-30 ratio, spending 70% of time on success scenarios and 30% on problem solving. How can you measure whether your mental practice is actually working? 4 key metrics indicate effective mental practice: image clarity, emotional depth, physical body responses during visualization, and actual performance transfer. Track whether you can maintain a vivid, detailed mental image for 30 seconds or more without distraction or loss of clarity. Monitor whether your heart rate and breathing increase during intense mental rehearsal, indicating genuine neural activation. Calculate a quality score by averaging your ratings of clarity, emotional engagement, and physical response, each on a scale of 1 to 10. Aim for a quality score above 7 out of 10 to ensure your mental practice is sufficiently vivid and engaging to produce neural changes. Let's examine how elite performers across different fields use mental simulation. Mental simulation is used extensively in sports, where athletes visualize competitions, and in surgery, where doctors mentally rehearse complex procedures. Olympic champion Michael Phelps famously visualized every race, twice daily, for months, before competitions, mentally swimming each stroke perfectly. Chess grandmasters routinely play entire games mentally, considering 15 to 20 moves ahead while maintaining multiple possible game states. Performance gain can be modeled as alpha times mental practice hours plus beta times physical practice hours, where both coefficients are positive. Commercial pilots mentally simulate emergency procedures over 100 times per year to maintain sharp responses without actual emergencies. Let's identify common mistakes that reduce the effectiveness of mental practice. 3 major mistakes reduce effectiveness: using vague imagery instead of vivid detail, only rehearsing success, and passively watching instead of actively feeling. The first mistake is watching yourself perform from an outside perspective instead of feeling the movements from a first-person internal perspective. The second mistake is rushing through visualizations quickly without building rich sensory detail and emotional engagement. The third mistake is failing to include mental rehearsal of recovery strategies when things don't go as planned. Poor mental practice techniques yield less than 30% of the effectiveness of optimal techniques, making proper form crucial. Now let's create a framework for building your own mental practice program. A structured 8-week program builds mental practice skills progressively. Imagery in weeks 1 and 2, emotional depth in 3 and 4, breakdown rehearsal in 5 and 6, then full integration. Start with just 5 minutes daily of simple, vivid imagery, focusing on one basic skill or movement pattern. Gradually increase session length to 20 or 30 minutes as your ability to maintain clear, detailed imagery improves. Skill progression follows roughly a quadratic growth pattern where initial gains compound as neural pathways strengthen over time, T measured in weeks. Keep a practice journal recording clarity ratings from 1 to 10, emotional engagement, and insights gained during each session. Let's summarize the complete mental simulation framework for peak performance. Mental practice activates 70 to 80% of the same neural pathways as physical practice, making it a powerful training tool. Elite performers distinguish themselves by rehearsing both ideal success scenarios and potential failure situations with recovery strategies. The optimal protocol involves 30 to 35-minute sessions, 5 to 7 times weekly, with a 70-30 ratio of success to failure rehearsal. Peak performance is a function of mental practice, physical practice, and adequate recovery time, all working synergistically. Regular mental simulation reduces performance stress hormones by 40 to 50% and improves mistake recovery speed by 60%. You can start today with just 5 minutes of vivid first-person imagery, focusing on one key skill you want to improve. Mental simulation unlocks your full potential by training your brain as rigorously as you train your body, creating neural excellence that translates to peak performance.